Students, good evening everyone. I'm Dr. Sanjeev Chitragar. Welcome to this channel, and today we are having a discussion about how to go about first year pathology residency. So this is going to be extremely useful for those who are currently in first year. Just a minute, there is some issue with audio. Guys, is the audio all right? Check. Yeah, so from my side. Yeah, it looks all right. Okay, okay. So let us, just go through what is required out of you in the first year residency. So if you are a part of first year residency anywhere in India, either MD or DNB. Okay. So let me just start, briefing you. First, congratulate you. Welcome to, this side that, you're going to have. Be a pathologist henceforth. So let's start working on how to become a better pathologist for you guys. So let me start with first slide of mine. So basically subdivisions of pathology. So what are the subdivisions of pathology? So we are having one, histopathology. This is one of the very challenging subdivisions of pathology. Then we are having cytopathology. So if you understand histopath well, then the cytopath will be easier because you will understand both of them are very much intricately related. And then we are having a different subject like called hematology, wherein you're going to have blood and the bone marrow and the other investigation. Next, one more we are going to have is blood banking as well. So although now there is a new branch created called blood banking, but still at many places pathologists can still be in charge of the blood bank. Okay, yeah. Next, one more, clinical pathology. So what is this clinical pathology? Clinical pathology is biochemistry. So basically, most of the pathologists, this is a very bread earning branch. Once you do pathology and you start your own lab, this is going to be, helpful. So basically, your hematology and clinical pathology are two important branches which are going to be, especially if you are in going to open your own lab, etc. So these will be two very, very important. But no matter what, I would always say the one which is very challenging is histopath. That is the one which is very challenging and which demands your brain basically. So that is what is so let us start with how to approach each one of them. So usually in most of the medical colleges, what happens, or in residencies, what happens is you are posted into all these three branches: histopath, hemat, and cytopath, on a rotational basis. Ideally, so initially for first 2 months is what we had in AIMS at that point of time. There can be variation, and after that we used to have it, order wise. So let us talk about histopathology. What is expected out of you? So what is there in histopathology department? So we are having one, grossing. That is very, very important part of histopathology. And another important part are the histotechniques that are there. So wherein, that is the lab aspect of the histopathology department, where how to fix the specimen, how to process the specimen, the histokinate, and how the sectioning is made, how the water bath is used, how do they pick the sections onto the slide, and how do they stain. Ultimately, that is histotechnics. And then the third part is slide weaving. Most of the pathologists will be included in the first and the third. The second one is more of technician's job, but you need to, as a pathologist, you need to understand what exactly is going in the techniques. Otherwise, when you see some artifacts, you'll not be able to pick it up that it was because of an artifact, and you might end up making a error in your diagnosis, right? So let me start with first grossing. What is grossing? So what skills have to be acquired? So basically I will be discussing it like this, that what skills you have to acquire there, and what books and what are your references that you can be using for them. And please free feel to ask any doubts, any questions if you are having in the chat. Okay, so please use the chat box to ask the doubt. This is a live session, you can be asking it. Okay, so in grossing, what skills you have to be acquiring? So usually you're made to write the description as your senior does the grossing. This is typical in most of the medical colleges. So writing doesn't mean bad. Writing means actually you are learning that. So keep everything, whatever you're doing, it might be a paperwork, everything. So remember, they are going to teach you all those things. So when you are writing, start making observation. So try to observe things grossly, try to make a gross diagnosis. This is one which is missing in most of the places. Try to make, looking at the gross examination, this is an adenomyosis, this metaplasia is there, or there's a squamous cell carcinoma. All these things can be made easily when you study the gross appearance of different tumors. And then ask your seniors, do they have any gross diagnosis? If they are making, if they are doing grossing, ask them that if they have any gross diagnosis, or they have arrived at any conclusions. Like I remember myself in my residency days, we were like hell bent on proving that senior residents who were signing out the cases, we were like, we used to give diagnosis, you'll not believe us, we used to give diagnosis looking at the gross. We used to give, okay, endometrioid adenocarcinoma, and we used to also, looking at this, we used to write staging as well, and we used to also sometimes mention well differentiated, poorly differentiated, etc. So many times our senior residents were asking us, oh, if you are giving everything, then what are we supposed to sign it out? Because grossly we were diagnosing literally, and many times, and it was a fun way that we used to cross check ourselves, are we right or are we wrong? Many times we used to write well differentiated squamous cell carcinoma, poorly differentiated squamous cell carcinoma, moderately differentiated as well, and even for adenocarcinomas, etc., we used to be doing that. And that's a good thing, you learn a lot of things there. Then very important, learn importance of each step that is done. So all steps are done for a particular reason, so you have to find out why it is done. Keep asking questions, that is the most important thing. Keep asking questions, even if you don't know the answer, don't worry. Try to find the answer by yourself first. So don't expect somebody has to keep giving you answers. Now as a PG, you have to start looking for the answers by yourself. Then next option would be take help of your senior. Then the last thing will be go and ask your professors. Otherwise your professors will usually get irritated. Then if I am going to tell you everything, then what are you going to do, kind of a thing. So don't want to be in that scenario. But make sure you keep asking questions. And then next, try to go back and refer grossing books. Once you finish your grossing, try to refer to the grossing books. Or if you are a part of the resident course, my resident course, which will include grossing, which has included grossing also, see how was your grossing different than the standard procedure done at Central Institute. So the grossing in my resident course, whatever grossing I am teaching, that is from Tata and AIMS, that is what a combination of Tata and AIMS that I am teaching. Okay, so what books do I refer for grossing? So grossing books, there are two important books which these are both of my favorites. One is Tata Memorial Grossing Manual. So this is Tata Memorial Grossing Surgical Oncology Specimen Manual. So we just call it as a Tata Manual. And another is Surgical Pathology Dissection. This is another good well, good illustrations are given in this book as well, so you can use both of these. Soft copies, hard copies, I would always prefer to read from hard copies. Soft copies references are fine, but for reading, soft copies will be tougher, although there are nowadays people use soft copies nowadays. Next, for histotechnics, which will include your staining process, the processing, all those things. For them, this is the book Bancroft. This is the best book which I have gone through. So this is what I would recommend everybody to have it. Bancroft's theory of histological techniques, which will include your everything. This in fact includes electron microscopy, immunofluorescence, IHC, everything is included in that. So definitely this is one of the book I would, as a first year, I would buy this book, and I would buy one grossing book, and I would be buying one histo and one cyto book as well, and one hemat book. Okay, so next is a skill to be acquired in the histo lab. So in the histo lab, that is histotechnics, observe the tissue processing, what exactly each step does in tissue processing that you should be knowing. Learn how to prepare 10% formalin all by yourself. This is important. I mean, not that you're going to make formalin in the future, but yes, you need to know how it is done. Try to observe how do they cut sections. If possible, try yourself. Again, it is just a way of learning things. You're not going to practice this in future, by the way, but still try to know that. Yes, common stain preparation. Of course, this you have to learn how do they prepare the stains, because when you come out and when you start practicing, many a times you'll not be getting readily available stain that is there. So you have to be doing that. Then staining procedure. Of course, this is a must. You have to learn staining procedure of important HND, pass, silver stains, the basic stains you should be able to stain by yourself. Uh, and uh, so what are the books that I would recommend for slide viewing? So slide viewing, there's a third part of your histopathology. This is one book. Everybody uses this. Ackerman, Rosai and Ackerman Surgical Pathology, which will include both neoplastic and non-neoplastic. So this is definitely for first year students. I will recommend, not first year, it is throughout for first year to final year, but this is one which I have to be buying in first year. Don't just go by soft copies. People think that I'll do everything in soft copies. You'll not be able to do anything on soft copies if you are into that. So please take these books, must to be taken. Now, so what skill should I be acquiring? Slide viewing. So slide viewing, this is the toughest part that you will be doing as a first year, I would say. Not even first year, any year, toughest part will be this. So try to identify normal tissue in all the slides. So very, very important. Any slide you get, you have to try to identify the normal tissue there. See all the slides initially with history, and by end of few months try seeing them without history, so that you have start thinking on your own. That is very, very important. Seeing without history. Yes, your brain works most when it is unbiased. So let it express. You may be wrong many a times, doesn't matter. Do not be afraid of being wrong. So you might be wrong, let it be, doesn't matter. Take it as it is. These are all learning curves. So you will not get things right. That's what I said. Don't get frustrated with it. Everyone goes through same. So pathology is totally different from what you did in undergraduation, because undergraduation you would have done 1.5 year of pathology, wherein not much of what you are expected to do as a pathologist, right? So don't get frustrated. Usually first year goes very tough for most of the people, including me. It was a tough one, but yes, usually after 6-7 months you start realizing, okay, what has to be done. Then once you know the diagnosis, either from your seniors or from professors after the case has been signed out, retrospectively read the same case from Ackerman and see the slide again. So this is the best way of learning for the first years. So once the case has been signed out, say they have diagnosed a papillary thyroid carcinoma, medullary carcinoma of thyroid, or a pleomorphic adenoma, or any tumor, once it has been signed out, take the slide out and read the Ackerman, see the slide again, try to identify what all things, whatever Ackerman has mentioned, are present in those slides, isn't it? That is how retrospectively, and do this one case daily. So every day, one case you have to be doing this. This has to be done whichever department you are in, hematology, cytopathology, or histopathology, doesn't matter. You have to go back and do every day one case. That means you're going to learn one new case every day. That will be around 365 in the first year. Most of your diagnosis will be done by that time. That is why. And next is cytopathology. So what exactly happens in cytopath? So in cytopathology, there are three parts, yes, or two parts basically: FNAC procedure and the slide viewing of FNAC, and then there is fluid and pap smear. So usually it is divided into fluids and aspiration cytology, right? So skills to be acquired in cytopathology. In FNAC, first observe the FNAC procedure. So FNAC has to be done by pathologists. This is probably one place where you are getting exposed to the patient. Otherwise, usually you have very limited exposure to the patient. Learn how to prepare smears of the aspirate. Try to elicit important history that is required for you. And if you are assisting in a FNA procedure, Ask your senior to give him a remaining sample after he has adequately sampled. Try to make smear of yourself. So, whatever sample is left behind at the end, use that and try to make a smear. Okay. So the advantage of you making a smear is you will get to an idea how much pressure you have to apply, because if you apply too much of pressure, there'll be crushing artifact, all those things. So that is why you have to learn how to get those proper pressure of the smearing technique, and keep cross checking the aspiration technique, smearing technique, and quality of the slides that you're going to have at the end, so that you will end up learning here. And yes, of course, you will be learning common stain preparations, like usually a pap staining is used in most of the places. Some people use HND only, the same thing that is used in your histopath. Other things, GIMSA is used. GIMSA staining is also used for FNACs or cytologies. So learn the staining technique. Then staining procedure has to be done from your lab manuals, because individual labs will be having individual things. And slide viewing and histological correlation of normal cells. At least initially, you need to know how a columnar cell will appear on FNAC, how a squamous cell will appear on FNAC, etc. So that is what you should be knowing. Now, what books? My favorite book, Orel. Orel is one of the best book for FNAC. Yes, it is more of like uh, Atlas, but yes, Orel is one. Cause I have not studied myself much. Only for Pap smear I studied this, but anyway, for Pap smear now I recommend something else. Pranab Day is another Indian author book, so you can refer this as well. Three books are there. Any one of them, I would recommend. My personal choice, Orel. I keep referring this. I have referred this in my post graduation, senior residency. Even till today, this is the book which I go for. Then for pap smears, so this is for FNAC. And for pap smears, okay, so fluid and pap smears, learn how to process the fluids. They do cytospin and so many techniques, so learn them. Learn how to identify normal cells in pap smears. So that is what you should be doing, and try to learn organisms as well in the first year. Abnormalities, it is very tough to find out, but yes, you start picking up as you go through. More the slides you screen, better you get. So in pap smear, there is no substitution for hard work, or in fact, whole of pathology, there is no substitution for hard work. You have to see more, then only you learn more here, right? And very important is keep marking the slides. So you have a doubt, this is what I feel LCL is there, this is what I feel HCL is there. Use a marker and try to mark there, and ask questions to your seniors or professors, whatever is there. And ideally have different colors. We used to have different colors for different people. Junior most used to use green markers, and then second years and third years probably they will use black markers and or red markers, whatever. So that even while seeing slides, your professor don't get distracted. If it is a green marker, probably he'll not put so much of effort looking at that. He might say it is normal, don't worry about it, kind of a thing. So you can do that. For pap smears, I would recommend this book now, Bethesda System of Reporting for Cervical Cytology. This you can use soft copy or hard copy, either of them is okay, because you're going to refer it once, so you can do that. Alternatively, all these the standard books which I'm mentioning, or I'm including in my resident course, all extracts from these books only. So my teaching is absolutely from all the standard books that I mentioned here. Apart from this, one more, WHO manuals, the blue books we say, which I'm not mentioning. That is not for you guys, but when I'm teaching, I will be teaching from that. Next is the hematology aspect of pathology. So in hematology, PBS, peripheral blood smear, and Coulter counters. So learn the technique, learn the how Coulter counters do the counting, all those things. Then cross check with smears, and then try to interpret the graphs that are there from the peripheral blood smear and from the machine, the counter machines. Then another aspect is in hematology is bone marrow aspirate and bone marrow biopsies, right? So what skills do I have to acquire here? Skills to be acquired in hematology: learn making smears and staining the blood smears. That is one. Second, learn how to do special test. Whatever is done in your lab, like osmotic fragility test, or uh, any of the PTA, PDT have been done in your labs, or whatever has been done, whatever you think, supravital staining, reticulocyte staining, etc. So learn to do those special tests, and then learn to do TLC, DLC manually, learn to interpret the graph from the counters, and keep doing that, cross checking yourself from the counter and from the smear. Usually the counter and the smear both will be done always. Keep checking yourself. That is a learning exercise for you. Do not overtly rely only on the machine, or you need not go and keep checking everything. So in a learning phase, you have to do both. Then you will understand, you will have your own idea, okay, this is where a machine can go wrong, etc. Then you have to know normal morphology of all the cells, both in the bone marrow and in blood. You have to learn them. So all the blasts you need to know, everything, those things. And if you get a case of a leukemia, usually, when leukemia cases, especially in places where there's not much of caseload, so then go back and read along with its DDs. And usually for leukemias, I would recommend WHO. So WHO manual I would recommend for hematology, and see the slide again. So that is what you'll be doing now. So books for practical hematology, for lab techniques, Dacey and Lewis, this is one. Of course, apart from this, your own lab manual. And then for hemostasis, you can refer it from online site practicalhemostasis.com. You can be using this for your hemostasis, right? Now, so what books do I recommend for slide viewing in hematology? Begin with, of course, have this Tejinder Singh, Dr. Tejinder Singh, Atlas of Hematology. I referred this. Then WHO book. These two I would definitely recommend. The Bone Marrow Pathology by Barbara Bain. That is probably by end of second year or third year. So this is the WHO book. Definitely yes. For all leukemias, you need to study that. Then from Tejinder Singh, this is an atlas, so that you end up getting a quick view. Alternatively, my resident course will end up including from Barbara Bain and WHO Hematology, and even Tejinder Singh also. Then for theory of hematology, Wintrops. This is my one of the go-to book for hematology theory part. So which will include all the other things apart from the WBC. So leukemia, lymphomas, you would have done theory from the WHO. For RBC, platelet disorder, transfusion, also you can be using the same thing. Another is Williams hematology. You can be also going through this Williams as well. Now, so one more standard reference for many of the students is my pathology master class for residents. I've been running this course for the last 2 years. Already there are more than 120 classes already recorded available. So this is an all-in-one course which will include histo, cyto, hemat, both theory as well as practical. I will be teaching you all the things already, and it is a more integrated, where I will learn hematology, cytopathology, histopathology, and gross in together. Weekly there will be live classes, and once the class is done, it will be recordings will be available. And yes, you can join this course. We have subscription right from 1 year, 2 year, 3 year subscriptions are available. And to this, I'm now introducing every week. Now we are going to have one slide session where exam section, there will be exam section also going on, so wherein exam slides will be available there. I'll be giving you the digital slides, and you'll be able to see the slides on the zoomable slide on your screen on your laptops. You can zoom it and you can watch exactly like same virtual slide you'll be having, exactly like your microscope. Only thing is on your screen. You can do 2x, 5x, 10x, 20x, 40x, all those zooms you can be doing and learning it. It will be a very nice way of learning. You can use these contact numbers. You can contact them and they'll help you out with this course as well with the better discounts. And this course will include so I told you there's a live class happening once a week, plus already recorded classes. Already 100 plus hours are available. So this will include grossing, histopathology, cytopathology, histocyto correlation, where histopathology and cytopathology correlation, Then there'll be hematology also in this. Digital slides I'll be giving you. I have started journal clubs as well in this. Only one journal club we had, but yes, we started journal club. Very in many of the places journal club do not happen. So how to have journal clubs? How do you present a paper? Everything that we'll be doing, and then slide seminar and mock exams as well. Mock practical exams will be held, wherein there'll be 200 plus exam slides will be given to you guys, and you'll be able to I will be discussing all those whatever questions will be coming in why etc. So this is about it. So I have not dealt with the two other aspects, that is transfusion medicine and clinical pathology, which will be more like a biochemistry and other things that will you will be doing it in your college itself. So any doubts if you are having, guys, I can take up doubts. I can keep few doubts at the end. Any doubts? So those who are watching these videos, please subscribe to this channel. Just hit the subscribe button so that every time there will be a new video that will be added, you will be able to get access to that video always. Okay, so I'm not having any just a minute, live chat, let me just see. Yeah, good evening, good evening. So there are so many who have joined, but I'm not getting the any doubts here. So you don't have doubts? Okay, I'll be ending this then. Goodbye, guys, and if you have any doubts, you can contact our helplines. They will help you out with how you have to go through the residency as well. Best wishes.